The director of the Regional Health Services shares tips to curb the spread of COVID-19 in this Renetta Court report.
Director of Regional Health Services, Mr. Javon Stevens, in an interview with this newscast, related what the Regional Health Service has done to contribute to the fight against the COVID-19 pandemic.
The Regional Health Emergency Operating Committee, headed by the Regional Executive Officer, supported by myself, members of the Rapid Response Team, stakeholders in East Berbice quarantine, including the police, the mayors of the three municipality. We meet every 48 hours at the Regional Democratic Council boardroom, and this is where we discuss everything COVID-19. I update them on what's happening in the region and the country as relates to COVID, and also make plans on how to fight or combat the spread of COVID-19 in East Berbice quarantine. To ensure the numbers remain where it is, we would have decided to implement a few measures. At the Berbice River Bridge, to the western end of the Berbice River Bridge, we decided we can put a security COVID checkpoint in place. We have a tent out there. The tent is manned by a number of health professionals. So all vehicles, all passengers entering East Berbice quarantine is subject to mandatory screening by our public health officials. At other facilities across Berbice, there is Skeldon Hospital, Mybe Curie Hospital, Port Brent Hospital, and National Psychiatric Hospital. We would have established screening points for all persons entering the facility, whether you're a visitor, whether you're a patient, or a staff. All persons are subjected to screening every time they enter the facility. We are very serious about COVID-19, and we really want to ensure that Region 6 plays its part in combating the spread of this deadly disease in East Berbice quarantine and in Guyana, an extension in Guyana as a whole.
Mr. Stevens also stated that the health institutions within the region are fully equipped to deal with patients.
All our healthcare professionals, all the frontline workers are working assiduously to ensure that COVID doesn't affect us largely here. So all these persons have to be equipped with PPE, they have to get hand sanitizers, look at Lysol sprays, etc. All these things that can be used. We have what we have right now. We don't have an abundance, but we have adequate amount. And I'm quite certain that within a few days, because we are collaborating very closely with Ministry of Public Health and Ministry of Communities, that we will always have what we need.
Guyana has recorded 93 cases of the coronavirus, one being in Region 6 with 10 deaths and 27 recoveries.
It is a fact that to date, Berbice has one recorded, I want to emphasize one recorded case of COVID-19, and it's a patient that was diagnosed in March, but since then to now, we haven't received another positive patient. None is recorded in East Berbice quarantine.
He also mentioned,
in East Berbice quarantine, we collect kids from the HEOC, and we collect kids 10 at a time. We don't want to have too much kids at the same, because we don't want to encourage persons to, or staff to do a test as they like. We do a test when you meet the necessary guidelines, you tick the necessary boxes, and our officers feel that you warrant a test, then we do a test. But test is readily available to us at any time. We can pick up from HEOC, but we collect 10 at a time for proper accountability.
The general public is advised to adhere to public health guidelines to keep themselves and others safe.
I'd love to make a call to all residents of East Berbice quarantine. First, I want to state that COVID-19 or coronavirus is very, very real. I want persons to understand that it isn't a gimmick. I want to ask all persons to please grab hold of the gazetted orders for the Minister of Public Health, Honorable Valda Lawrence. These orders was made public on April 29th. It talks about a curfew, it talks about non-essential services, etc. Please take a good read of the document and please try your best or do whatever it takes to adhere to those guidelines. COVID does not discriminate, whether race, financial status, or creed. COVID would not discriminate. COVID is everybody's business, and we also take it very, very seriously. I want to urge you to maintain social distancing. Remember, 3 to 6 feet. Also, wear a mask when you're in public, and wash your hands with soap and water as much as you can. If you don't have access to soap and water because of where you are, please ensure you use an alcohol-based sanitizer to keep your hands properly sanitized.
Reporting for Channel 8 News, Renetta Kurt.